A huge welcome to the entire team here at Hospital Sultan Idris Shah, Serdang. We all see patients every single day who aren't necessarily sick, but every one of those visits is a critical piece of their health journey. So today, we're going to dive into how we can make sure every single one of those encounters is documented perfectly.
So let's start with the big question, the one we all run into. How do you actually document a visit when the patient isn't sick? Think about it. All the routine checkups, the follow-ups, all that preventative care we provide, these are things we do all the time. And documenting them correctly is what tells the real story of the care we're providing here at HSIS.
Well, the answer is ICD-11 Chapter 24. This is our go-to tool for these exact situations. Now, the official name is a bit of a mouthful, factors influencing health status or contact with health services, but just think of it like this. It's for any time we're observing, monitoring, or helping a patient who isn't acutely ill.
I love this phrase for it. Chapter 24 is our well, but still important chapter. It's for every single one of those moments that matter in a patient's health journey, even when we aren't actively treating a specific disease.
Okay, so let's really bring this home. For us, right here, our team at Hospital Sultan Idris Shah, Serdang, why does getting this right really truly matter? Well, it's everything, really. Using Chapter 24 accurately lets us tell the complete, true story of our hospital. It means we capture all that vital preventative work, all the crucial safety monitoring we do, which, let's be honest, can sometimes get lost in the numbers. This leads to much more accurate Casemix data, and that, in turn, really reflects the amazing patient-centered care our team at HSIS Serdang delivers every single day. All right, let's make this real. We're going to walk through a few examples, starting with a very common one, a preventative checkup, specifically a routine surveillance colonoscopy. So here's the scenario. A patient comes in for a routine surveillance colonoscopy. Why? Because they have a personal history of rectal polyps. We do the procedure, and great news, the findings are totally normal. There's no active disease to be found.
Now just look at the difference this makes. Normal colonoscopy, it's technically true, but it tells us almost nothing. The correct documentation on the right, though, that tells the whole story. It gives us the reason for the visit, surveillance. It gives us the context, that history of polyps. And it gives us the outcome. It perfectly captures the value of the work we did.
And this just nails the main point. The whole reason for this encounter wasn't an active disease. It was about responsible, proactive, preventative care. When we document it this way, our Casemix data actually reflects this critical work we're doing here at HSIS Serdang.
Okay, great. Let's tackle another super common situation. This one is all about making sure our patients are safe by keeping a close eye on them after a procedure. So in this situation, a patient has had an MRI with gadolinium contrast. Just as a precaution, they're admitted so we can monitor their renal function. Again, there's no illness here. We are just being thorough and diligent.
And again, look at the night and day difference. Admitted post-MRI is just so vague, but the correct documentation, it's crystal clear. It tells us why they were admitted for observation of renal function. It tells us what prompted it, the MRI with contrast, and it gives us the outcome. This is just a perfect example of documenting our excellent clinical judgment. This is a classic Chapter 24 case. It's a medical observation for something we suspected but ultimately ruled out. Documenting it clearly doesn't just show off the amazing safety culture we have here at HSIS. It also gives our coders exactly what they need to assign the right category, which is QA02.
For our last example, let's switch gears a little bit. We've talked about prevention and safety. Now let's look at another incredibly important area, the rehabilitation journey.
So this one's for our rehab heroes. We have a patient with a right above knee amputation, and they're admitted for a very specific positive reason, to get fitted for a prosthetic limb and to get the training they need to use it. You see, if we only document the history of the amputation, we completely miss the point of this admission. The right way to do it focuses on the reason for this specific visit, that proactive, positive step of fitting and training with a prosthesis. Getting this detail right makes a world of difference for our rehab stats and for showing our commitment to patient-centered care.
So just remember, an encounter like this is all about functional improvement. It's not about managing a disease. That's exactly why both the history of the amputation and the need for the prosthesis get documented right here, under Chapter 24.